Thank you to SAGES for inviting us to present our data. These are our disclosures. So why does this matter? We know that over time, the use of ERCP in the pediatric population has been increasing, and the complication rates for ERCP are around the 5 to 7% rate, which is similar both in the adult and the pediatric population. Post-ERCP pancreatitis is the most common complication associated with ERCP. And by now, we have good evidence that ERCP is safe in the pediatric population. So with growing numbers of surgical endoscopists performing ERCP, we wanted to know what are the outcomes of surgeons who are doing ERCPs in the pediatric population, as there is not much data. So our study is a retrospective review of pediatric ERCP cases performed at Jackson Memorial Hospital, which is an academic center in Miami, Florida. We looked at cases from August 2012 to August 2022. And all the cases were performed by 3 fellowship-trained surgical endoscopists. Our inclusion criteria was patients under the age of 19 years old who were either inpatients or outpatients. And the data we collected included demographics, the indications for procedure, procedure-related data, and 30-day complication. So we performed 168 ERCPs in a total of 146 pediatric patients during this period. Our mean age was 13 years old, and our youngest patient was 2 months old. As you can see, the majority of our patients were female. Most had not had a prior ERCP, and the most common indication for ERCP was cholelithiasis, followed by evaluation of and treatment of PSC and liver transplant complications. Here's a breakdown of the procedural characteristics. 99.4% of our cases were performed under general anesthesia. Only 1 was done under sedation, and this was in a teenager. Our most common procedures performed were sphincterotomy and removal of stone. On average, we performed 1.9 procedures per patient. And our cannulation rate, defined as deep cannulation of the desired duct, was 95.8%, which is within the reported literature as well. Our procedure duration time on average was 31 minutes, and our complication rate was 5.3% overall, with 6 post-ERCP pancreatitis and 2 mild bleeds. So we demonstrate that ERCP is safe in the pediatric population when performed by fellowship-trained surgeons. And big kudos to our group for putting this work together. Thank you.